Hi everyone, you're listening to Let's Psyconnect. This is LT.
And this is Ronnie.
You can also watch this conversation today that we're having with a special guest. And we're going to be talking about imposter syndrome. Ronnie's going to give the introduction in a little bit. But as I said, you can watch this conversation on IGTV as well as YouTube because we're not releasing our episodes on YouTube. And you can send our feedback to us via discussion@letspsyconnect.com. So I said that we're going to be talking about imposter syndrome, and I can't wait because there's so much to learn about and talk about. This topic is out there in the media, and so we brought in this guest who knows a lot about this topic, and I hope you guys enjoyed the conversation today. So Ronnie, introduce us.
Of course, I'm extremely excited about today's conversation and today's guest. So I'll just give a brief bio, and then we'll get into our very stimulating conversation. So Dr. Lisa Orbe-Austin is a licensed psychologist and executive coach with a focus on career advancement and leadership development. She is a co-founder and partner of Dynamic Transition Psychological Consulting, a career and executive coaching consultancy where she works mostly with high potential managers and executives. She earned her doctorate in counseling psychology from Columbia University. Her area of expertise regularly sought by the media, and she has appeared in outlets such as the New York Times and Business Insider. She has also been honored as a top voice on LinkedIn, the area of job search and careers. Dr. Orbe-Austin has been invited as a speaker at various national conferences, and she recently gave a TEDx talk entitled The Imposter Syndrome Paradox. She regularly consults with organizations in the private sector, nonprofits, and educational institutions in supporting their employees and senior leadership teams. Furthermore, her book, Own Your Greatness, Overcome Imposter Syndrome, Beat Self-Doubt, and Succeed in Life, co-authored with her partner, Dr. Richard Orbe-Austin, was released in April of 2020. So without further ado, welcome, Doctor.
Thank you for having me, Ronnie and LT. I'm happy to be here.
Oh, we're so excited.
Yes. So what a great introduction and a great bio. So I just want to go ahead and get started and just give you the floor to talk about kind of your background and mental health and how you got to where you are right now.
Sure. It's a long story, but I'll abbreviate it for you. So as a counseling psychologist, one of the areas of expertise is career. In essence, that's how our field was born. It came out of the 1950s after World War II, where a lot of early counseling psychologists worked in VA systems and were the first people to do voc rehab with people who were coming back from World War II. And so that's how the counseling psychology sort of birthed in the VA system. And it was where counseling psychologists began to kind of do work on the ideas of career development, career theory, metrics, all of these pieces. And it became very much a part and a strain of our field. To this day, we still are kind of the experts in the field of career development. People don't often realize that we are the ones who kind of develop the theories. And but most of us, when we get trained in this area, really hate it. It's not really what we went into the career to do. We went into therapy, and we just feel like, what is this? And so we just get through the requirements and we go be therapists. And I think that was my perspective too. I really had a pretty dry career class, and I had a career externship, and it pretty much was supervised like, okay, give them the tests and then do therapy. And I was like, well, where's the career counseling? I don't even understand how it works. And I never understood it. So I was just like, I'm never going to do that. And then when I guess I was in my final year of my it was my second of last year of my doctoral program. I got a new job working in a career center. I met my husband there. And we became friends, and he really loved career development, and he would talk to me all the time about how the professional was personal, the personal professional, and connected identity to career for me. And I loved identity work. That was the focus of my own interest in my doctoral program, was racial identity and identity work. So when he connected that for me, it really became alive, and I could see why career work was so exciting. And so that was the beginning of the road for me. And then there's been some other windings. A postdoctoral supervisor who was a counseling psychologist and executive coach. She helped teach me about how to use the testing, how to think about a practice. So I've had major influences along the way that have kind of helped me to do what I do today.
Yeah. Well, thank you for sharing that for sure. And I think it gives people a different perspective on what psychologists can do too. And I'm a big fan of executive coaching. I'm a big fan of organizational psychology of the universe out there. I do love it very much. So I do appreciate you sharing that with other people too. Uh, so how did you get from this like career counseling field, you know, the idea of working with executives and whatnot, to writing about imposter syndrome?
Well, I mean, I think one of the things that, you know, Richard and I always talk about is that our practice, for us, you know, a lot of therapists, a practice is like a place where you get to practice therapy. But for us, we wanted our practice to be a business. And yes, we do therapy within that business, but we have a business. And so we've always been very committed to the business aspect of our practice, including marketing and other aspects of our, you know, of our business. And so in the scope of that, one of the things that was very important was marketing. So one of the things we were doing pretty often was writing. And so we were, you know, putting out our thoughts on different career issues here and there, LinkedIn and other places. We'd have a blog on our website. And then we were approached, I guess it's now like a year and a half ago, by our editor, because she had seen different things that we were writing about, like different career issues and imposter syndrome. She said, look, our publishing company wants to do a book on imposter syndrome. We'd love for, you know, you to do it. And we were just kind of like shocked, because it felt like the perfect topic for us. And it felt like such a great fit. And so that's how it came to us. It was like through the marketing work we were doing, we became visible to a publishing house.
Yeah, I mean, I think that it inspires other people to maybe like, I guess, aspire to become a writer, to become an author.
To put your thoughts out into the universe, right? Put them out there. I mean, I think oftentimes as doc students, we get very caught up in like, you know, it being like the perfect product and representing things appropriately. And that's important, clearly, but I think it's much more important to be able to share your thoughts and be able to kind of, you know, develop a community around them. I think that's sort of what we did. You know?
Yeah, for sure. And then, so what is imposter syndrome? Because I'm dying to share that with everyone out there and to learn from somebody who knows more than anybody.
Well, I'm not sure I know more than anyone. I think Plants probably
know more than us.
Definitely more than us.
So it's a phenomenon. It's not a mental health diagnostic category. It's a phenomenon. It was found by two psychologists, or discovered by two psychologists, Clance and Imes, in the late 1970s, when they were working in a college counseling center in Georgia. And they were working largely with women, and they noticed in these women, these accomplished women, they were administrators at the university, deans, professors, grad students, and they noticed that despite all their accomplishments, all their abilities, all their skills, that they felt like they were frauds, and they feared this kind of experience of being revealed as incompetent, so much so that they overworked at like these extraordinary levels in order to kind of hide this feeling of perceived incompetence. Or they engaged in this idea of self-sabotage because they were feeling so much performance anxiety. So that's when they began to kind of formulate this idea in the late 1970s. And since then, there's been a fair amount of research in the area to kind of talk about the different ways it shows up and broaden the idea that it just doesn't happen in women. So it's, you know, it's taken off since then, but it's a concept that, although it's become popularized in the last, you know, 5 or so years, it's gotten a big surge. It's
Right.
been 40 years old. Yeah.
Nice. Yeah, go ahead, Ronnie.
Yeah, so you touch on a little bit of the presentation of imposter syndrome, and I'm wondering, what are some more signs and symptoms, or maybe underlying signs and symptoms, that we could see as future clinicians or current clinicians could take into consideration?
So yeah, there are certain signs that I think are really common, or we know are really common. One of them is sort of perfectionism. So we see perfectionism very much underlying this. Fear of failure, fear of success, you know, people who are quite high achieved, pretty substantial achievements. We're not talking someone who just got into a job and feels like they're an imposter. Like that just may be developmental, but somebody who has significant achievements and then still fears this fear. And I think, it's got all these different kinds of correlates to it. Oftentimes too, there's some childhood experiences. Oftentimes we hear that they were considered the smart one in the family, the one that was really intelligent, but the idea was that intelligence required no effort. And so if they had to give anything effort, then they felt like, see, I'm not as smart as everyone thinks. Or they were the person who in their family wasn't considered that smart. Everything had to come through hard work. So their idea is, I don't have any natural skills or talents. Everything I must kill myself to do anything successfully. And then the third one, which isn't talked about in the literature. So those are the two ones that are talked about in the literature. But Richard and I, when we were talking through the book, we used the literature, but then there were lots of gaps in the literature. And so, one of the things we saw in our practice was there's somebody who doesn't fit either of those two examples. And that's somebody who didn't have a lot of parental involvement in their family. Like in their family, nobody was telling them they were the smart one or the hardworking one. There was a lot of parental neglect or a lot of caregiver absence. And as a result, they were always in survival mode. So all of their achievements come as a method of survival. And so they can, we've worked with them and they can be CFOs, CEOs, and like, they're so worried that if they screw up, it's all going to go away. And it comes from this internal experience of being neglected and traumatized in those ways. So, that is the third type we've seen with an early experience like that.
And correct me if I'm wrong, but it might come to mind, or like the way that they present themselves, and I guess in front of us, professionals, mental health professionals, with symptoms of depression, anxiety. Sounds like that there's a lot of self-doubt, right? Difficulties with the self-esteem. It might fluctuate. Sometimes like, yes, I'm right there. Sometimes like, nope, there's no self-esteem here. So what else can you tell us about, like, what else is associated with, I guess, imposter syndrome?
Yeah. And so, yes, you're right. The anxiety and the depression are very much a part of this. So that's the diagnostic pieces that you'll see. But oftentimes you can see it very much linked to work performance, because oftentimes it's a very work-related experience. Yes, it can occur in families and in relationships in other ways, but the way that we see it most often is in work. So typically we'll see somebody like, make a mistake at work and it's crushing. Like it puts them into a spiral, a depressive spiral. They can't get out of it. They can't sort of let go of it. That's sort of where we begin to see it, where it looks a little different than other people's depressions. It's triggered by a particular, situation or scenario that is very reflective of the imposter syndrome and then just sinks them. I think the other thing is that there are some family dynamics that are very common. So we see codependence pretty common with people who have imposter syndrome. And we see also narcissistic caregivers. So we see a lot of narcissism in sort of their histories. And so those are other factors that we sometimes see also. So personality factors that we see.
Because I'm wondering, like you mentioned that you see more at inside of the work environment. But if the person's experienced all those feelings and symptoms, right, they probably bring in some stuff home too. And I don't think
for sure.
Okay.
Yeah, I mean, that's what I was saying. Like, typically, because of what we do, it leads with the work stuff. They don't lead with like, I'm codependent at home. So it leads with like, I'm not doing very well at work, or I'm really struggling with like, my performance. I don't know how to kind of get it to the next level. You hear these very innocuous kind of complaints that feel pretty benign, but then we start to look at it, this whole system of weighing of behavior and the way that they're kind of engaging. And then you often see codependence at home and other things that kind of, you got to work on too. I think, that's why I think psychologists are uniquely kind of positioned to kind of work on these particular issues, because yes, imposter syndrome isn't a diagnostic condition, but the other things that like come connected to it are,
Okay. So
go ahead, Ronnie. Yeah.
So we have kind of this presentation, right? And I'm wondering, and we'll get to treatment and adaptive coping skills in a little bit, but I'm wondering, what are some maladaptive coping skills that you've seen in your practice working with these individuals, and just in your research with writing the book, that maybe the individual feels, okay, I'm going to combat this presentation by doing this, this, and this, but it actually is doing the opposite, doing the contrary.
Yeah. I think what's interesting about the maladaptive coping skills is that sometimes in our culture, in our society, their particular maladaptive coping skills are seen as quite adaptive. So for example, they overwork. And so they work like 10 times as hard as anyone, or they work at capacities that are far beyond what they should be working at. But oftentimes in our society, that's rewarded. So they're doing things that look really like, just like they're killing it out. They're killing it. They're knocking it out of the park. But
Right.
you can see there's usually a cost because they're also experiencing burnout and other things. They're just feeling sort of like depleted by the experience. But on the surface, it doesn't look like some maladaptive behaviors that come with other dysfunctions where you're like, no, that's clearly maladaptive. It's sort of guised in like, these things that seem fairly innocuous. Also, like we see a lot of self-sabotage. So what's different about the self-sabotage for somebody who has imposter syndrome, though, is that they will wait till the last minute or procrastinate or do something like that, self-sabotage oriented, but because they know how to overwork, they're going to kill it in the end. And so then they end up performing pretty well anyway. Maybe there's some slight issues or whatever, and they blow those up and they make them like, see, I can't handle this. But they know how to kill it. Even like some people self-sabotage, like, and it's done. Like they just blow it up. They're not really people who blow it up. They know how to succeed even when self-sabotaging themselves.
Which again, it sounds like it can be very difficult for the person to acknowledge that there's something going on that is maladaptive to them.
Yes.
Because in the end, they get the result and they might just like brush it off. But it's interesting possibly with interpersonal relationships, this sleep pattern. Like, no, but I'm getting it done.
Yeah, and I think that's why they're often resistant. They want to let it go because there's the burnout and there's the anxiety, the depression, the other consequences. But there's some part of them that feels really sometimes allied with the imposter syndrome. They're like, it got me to where I'm at. Like, I'm not sure I want to give it up, because if I give it up, the perception is everything's going to fall apart.
Yeah.
And it's not true.
I can see so many people saying like, oh yeah, but I've worked so hard and it all panned out so well for me. Like, you think?
Yeah. Why would I give it up? Yeah.
Yeah.
I can
you
trust
can't sleep
it.
well, you can't eat well, like all of those things are affecting, right?
Yeah. They're like, they're like, I've been through this before. So, so they do wax and wane. And like part of the work is kind of helping to disengage the identification with the imposter syndrome as the reason why you are successful. It is not the reason why you're successful. You need to kind of begin to also understand the strengths, the competencies, the skills that you have, and identify them, and not act like it's mysterious why you're successful or the imposter syndrome is what's doing it.
I see. And I can see, okay, so now I'm like wondering, how do people perceive, or receive information like, oh, you are telling me all of this that match with what in imposter syndrome. So how do they receive the full, like the two words together, and then the word syndrome that I already have a problem with?
Yeah, Lance and Imes do too. They don't like it. They like phenomenon, but nobody's using phenomenon.
So how do they cope, I guess? Okay, so you have imposter syndrome. Because both words actually have negative connotation. Like, no, I'm not an imposter. Will you call me an imposter? So tell us about that.
I mean, a lot of my clients are pretty educated, so they're pretty high achieving. So they do often know the term by the time they arrive. But what's interesting is on Instagram and places where I'm talking about this more often, a lot of people will feel attacked, and they'll say to me like, you're attacking me and things like that in the comments. Because I think they think that it's implying that they are truly an imposter. They have to kind of do the deep reading to realize it's the paradox of it, is that you're not an imposter. I think, the people who are imposters have like Dunner's Kronig syndrome. That's not what you have. It's the opposite of that. And I think it's sort of like educating them. And I think the other piece that I've seen really commonly is people sort of feel like, oh, I have imposter syndrome. And it's like, okay, that's it. It's going to be like this all the time. And they don't realize that there's actually things you can do about it. Or they just, feel like those things are either too hard or not going to work for them. They get sort of resistant to sort of feeling like there's possibility to change the behavior.
Yeah. I'm sure that it's not easy to receive the message right away.
But some people really want it. People really feel like, I have imposter syndrome, but it's like, okay, now what? Then? Now what?
So that brings us now to, I guess, adaptive coping skills. So what can we do as mental health professionals, and what can the clients do as individuals to like navigate through that and then be on the other side, like, no, I don't have imposter syndrome? Or can they ever say like, no, I don't have imposter syndrome? Or is it something that it fluctuates and go back and forth?
Yeah, I mean, I think what I always say is that it's not popular in American culture. We want to wave a magic wand at everything and make it go away. But it's probably not going to go away. It's probably going to be with you probably like the rest of your life. You're just going to turn the volume down so low that you can barely see it anymore. So with the skills, I think that's what you're going to do. But, I in my TEDx talk, I talk about the fact that I've had imposter syndrome. And the way it controlled my life 15 years ago is not at all what it does today. Like I'll get triggered, but I'll still be able to succeed and accomplish things. Where in the past, it just paralyzed me and I wasn't able to do some of the things that I had dreamed about or wanted to, didn't believe that I could. And so it affects me so differently now. It still happens and it still happens pretty, regularly. It doesn't bother me as much and I know what to do with it and I have the skills around it. But I think that, so some of the things that I think that are important for a therapist to think about when they're working with someone with imposter syndrome is to not minimize it. So just because it isn't a mental health diagnosis doesn't mean you don't have to treat it and work with some of the issues just related directly to imposter syndrome, not just the anxiety and depression and those pieces too. They have to be treated, but also this experience of imposter syndrome. One of the things that I think is really important is doing a really deep history. So, in my book, we do sort of like a very kind of like, pop psychology history, but I would encourage a therapist to do a really deep history of sort of, their origin issues, the family dynamics, like, their own experience of whether or not they felt, smart or, what was the kind of characterization of them in the home? Like, what were the messages? Like, what were the messages around performance? And because that's another piece of this is like, it's often families that are, value achievement over everything else. You don't get noticed unless you're achieving. So like looking for all these signs and sort of symptoms of imposter syndrome and helping them to understand how it developed, because a lot of people are so like, how did this happen to me? Like, I don't understand. And it's gonna be so organizing for a person to understand, like, this is how it happened and this is how it got there. It's especially helpful because when you're trying to help them learn how to identify triggers, the patterns that you see in their early childhood are often reflected in their triggers. So if they had a narcissistic parent, they're often usually attracted to narcissistic bosses, so you'll see that pattern replicate. Or if they, if you see them, if they have codependence dynamics in their family, you often see them engage in codependent codependent dynamics in the workplace, right? The workplace becomes their family. And like, so you start to see what you have to kind of work on and they start to see what they have to work on. I mean, I think it's also doing things like helping people to kind of use CBT work around automatic negative thoughts, especially the ones related to their imposter syndrome. I think it's also about teaching people the value of self-care and teaching them about, how to really institutionalize self-care in their practices and what self-care really means. I think it's also about teaching them to kind of build community that's healthy around them. That helps them to kind of not codependent community, but community that can really, give you useful feedback and constructive feedback, and also can serve to help you, be surrounded by people who get it and kind of help you move forward. So it's like all of those factors that I think are important as you kind of work through treating it. We also do a lot of narrative work, like helping to shift the narrative from a thin narrative to a thick narrative,
So it's almost like a multifaceted approach, or
that's the way we do it from a very multidisciplinary approach theoretically. Like we're just using all the things that we think have worked and also that the literature says works, right? A lot of it came from research that says that's useful.
And because you wear several hats here, like we know about your executive coaching background. So with coaching, do you guys rely on the coaching skills and techniques to help somebody through imposter syndrome, or it sounds like you rely more on the therapy-related techniques for that?
Well, to be honest, when we started, what we do really is career counseling, but people don't like that word, and so they think of it as like therapy, and some people don't want to come into therapy, and so they often, will much more have a preference for the word coaching. And so that's why we use the word career coaching. But to be honest, our career coaching is very CBT based. We're using CBT techniques that we've been trained in, and that's how we coach, is our cognitive behavioral work. And so it's not some kind of like, we didn't take a coaching certificate or do anything. We use our CBT skills, which are very coaching oriented and where a lot of coaching comes from and has kind of like, utilized. very kind of work like that helps people to move forward. We're not using some kind of like life coaching, you know, but people don't like the word. So
sure, yes, that's another core belief to work on for sure.
yeah, exactly.
And I was wondering here, so you know how sometimes, well, we often encourage people to talk about their mental health, right? Especially because again, you're trying to engage and build that social support system. And is this something that we should be encouraging people to talk about, at least at the workplace? Hey, I'm getting treatment, or I'm working on imposter syndrome, or I'm like trying to set boundaries here, help me out, kind of thing.
I would say it depends on the workplace. You know, I've done work in organizations around imposter syndrome, and they want to have an open culture around it. So like there are certain organizations that I've done work around, like, you know, I worked with Peloton, and they were very like, let's just talk about this. And I was like, they're awesome. Like, you know, they were just really like, let's embrace this, that you can bring this up in our communications and like, they were just like embracing the heck out of it. And in those kinds of circumstances, you can bring it up where everyone has the same language and is using it and really is supportive and wants that. I think, you know, in organizations where, you know, this isn't, I'm not necessarily encouraging my clients to run to their supervisor and tell them that they're in therapy or they're in coaching and like they're at this imposter syndrome.
Yeah.
But help them learn to take some sense of agency and manage it, because you don't need to like, you know, have a conversation with your boss around like, you know, I'm working on this issue, so kind of help me. You can just be like, I'm leaving. I'll see you at 6. I'm leaving at 6:30, and you know, I'll see you tomorrow. If there's an issue, let me know. And like, you know, there are ways to set boundaries that don't rely on somebody else allowing you to take the boundary. And so, like, you know, especially because people who are having imposter syndrome are already working so hard, typically, you know, their ability to cut back usually is working like normal hours, as opposed to working like 12 or 15 hours. They're now working normal hours. And I think also too, like, it's so important for the skills around agency and being able to kind of not behave codependently and really like be able to assert themselves. And so part of that is what I'm trying to also teach.
Thank you. Yeah. That's good.
Yeah. So Doctor, I want to talk a little bit about your experience and expertise in career counseling, right? So you mentioned that's of course how you got started before writing the book on imposter syndrome. And I was just curious if you could share with our listeners, what are some presenting problems that individuals may come in with?
In with career counseling. Yeah, I mean, typically they come in for a couple of reasons. One is that they're unhappy in their job and they can't figure out whether it's the current organization they're working for or they hate the career. So that's one very common issue. Another one is that they felt stuck in their career and they're either not sure how to advance, or they're not sure if they can advance in the current environment and they've got to think about another environment. We have people who hate their careers. They know that and they need to kind of pivot, but they don't know what to do next. And they're afraid to take any random thought and move on that. And so
when you work with, let's say, either imposter syndrome related or if it's not related to imposter syndrome, do you see anything like particular to like, okay, those individuals with this cultural background and whatnot, they tend to present ABC versus people with different backgrounds that tend to present DEF kind of thing?
I don't really generally see, I don't really generally see a lot of like, different cultural background, like certain things falling along cultural background lines. I mean, I guess, I do see a lot of like women and women of color struggle with really hard charging with advancement. Like really, they often feel like they want someone to recognize and give them the promotion instead of ask for the promotion, where with a lot of men, they'll just be like, I'm ready for the next level. Like, what do I need to do? And so men are cultured and socialized in society to kind of really feel like they can go get and take what they want. And so I think oftentimes women are very cultured to be relational. And so they're often trying to build these relationships and stuff, but are not asking for what they want and need. So I often see gender dynamics and there's some racial dynamics also with sort of like salary negotiations, advancement issues, like really sort of being able to clearly spell out what they want and where they're going. And so that's probably something that I do see.
Mm-hmm. And I can imagine, because research does show that even when women do ask for increase in salary, men are more likely to get than women who are asking for the same thing anyway.
Yes, exactly.
This is a whole different conversation here that we have to definitely change.
Yes.
We are almost running out of time here. I was wondering if, like, Ronnie, do you have an additional question? And of course, if you want to add something else to it too.
Yeah. So something that I did want to touch on, Doctor, is so with everything going on with the pandemic and COVID-19, and of course, I know that your patient demographics are more likely to be in the business field, business aspect. I was wondering, was there any change over the past few months in terms of an increase of individuals coming in, increases of worry about job security, anything related to that? Could you speak on that a little bit?
Sure. So I do think, like, what's interesting about this recession as opposed to the 2008 recession is that the 2008 recession hit hit everyone blanketly. It hit everyone sort of evenly. It sort of crushed everything. Where this one is it's kind of like very variant. And so some industries are doing incredibly well. They're blowing up and they're bursting, and ours is one of them. And then, there's some industries that are not sure how it's going to affect them, and some that are getting killed. And so most of my clients are in the industries that are either not sure or are doing really well. And so a lot of them, they may have concerns, but they're very abstract currently because there's nothing really happening to them, or there's no clear indication to them yet. They're still concerned. We're all concerned, but it's different. It's definitely different than that urgency. And the thing that I do see most often is that people are having trouble setting boundaries with, like, work from home. And so they are feeling like incredibly burnt out, feeling like they shouldn't be taking vacation because where are they going to go? So they're really not, they're kind of like in these bizarre sort of circumstances where they feel like really burnt out, but unable to take a vacation because there aren't many options, and sort of feeling like if this goes on for like 6 months or who knows how much longer, like, what's going to happen to me, because I'm sort of feeling burnt out already. And so I do think there is probably a little bit of overperformance going because people are concerned that they want to leave a good impression with their employers. But I do think, like, for me, the issues have been around setting boundaries and really helping people to understand and craft out separation between work and home life, and really kind of help them to kind of, even though they're with their families and stuff, there's not a lot of attention being probably spent in them because they're much more focused on kind of performing at work. And so kind of helping them to find some balance in that way.
And with these historic events, do you see more of, like, I guess, an increase in imposter syndrome, or does that get masked because of, like, I really want to show and, like, work more because I don't want to lose my job because of the historic event that's going on? And so it's hard to say, like, this is imposter syndrome or this is, like, somewhat normal reaction.
I mean, I did an article for today.com around this, and I do think imposter syndrome is increasing with COVID. I think it's being triggered. I don't think it's increasing in terms of, I think it's being triggered. And so because of the idea that you could be in a fragile situation, we don't even know. Something could happen that could affect your industry in ways we can't even sort of predict at this point. So I do think a lot of people are sort of feeling kind of more triggered for their imposter syndrome at this time, which is also why they're struggling to take vacations and separate and, like, create boundaries, because they really don't want to send the message, like, to their employer that, anything matters more than their job currently. So I do think it is kind of being triggered pretty proactively during this time.
And I want to just take back my word here because I did say normal reaction. Okay, I don't like when I say that, so I'm calling myself out on it. So adaptive from all adaptives, I'm sorry. This has been amazing. I want to leave the floor to see if you want to add more additional words so that our listeners have something else to hear from you, and also where they can find you and continue to learn more about your work.
Sure. I mean, I guess, like, what I'll say is also a lot of therapists also experience imposter syndrome. And I think it's very common amongst us, and it's often really hard to kind of take ownership for that because, we are always trying to prove to somebody, whether it's our supervisors or advisors, that we are competent. So much of our struggle is to kind of constantly prove that. So I do think that is very triggering. And I do think, like, also identify it if you have it in yourself and work on it. It's so important. I wish I had worked on mine a lot earlier. I might have made some different choices with my own career life earlier on. So I would encourage therapists to kind of really consider the ways in which it's impacting them and what they can do to alleviate it. It's tricky in doctor programs and master's programs, but it's possible. And so I would encourage it. So, and then you can find me, I'm on Instagram at Dr. Orbe-Austin. I'm pretty much obsessed with imposter syndrome. It's all I really talk about, and career. And I'm on, you can follow me on LinkedIn. So I'm also talking there about like imposter syndrome directly in work. So.
Thank you. And if you guys didn't get that, don't worry, because just read over our description and you're going to find the link. We're going to tag her over there so that you can connect with her even, you know, and just continue to learn from her, because she has a lot to contribute. She has done so much. And I'm glad you're in this type of work, because now we're Psyconnected, okay?
Yes, we have Psyconnect. We have Psyconnect. I'm going to adopt you guys. So.
Yes. Ronnie, do you want to add anything to this?
I just want to say thank you for your time, Dr. We really appreciate it. It was so insightful, and I gained a lot of information. I think something that just isn't talked about much, especially not in I think kind of the general trainings in the mental health field. So I appreciate you spending your time and a lot of your career work on a topic to expose it a little bit more. I appreciate it.
Oh, you're so welcome, Ronnie.
Yeah. And thank you again for also adding, you know, and bringing attention to like our mental health. As mental health professionals, we are also responsible for our mental health, not just over our clients. And so self-care, guys, self-care, okay?
Yeah, it's serious, like it's real.
The number of burnout is very high among us.
Yeah.
So
Yes.
let's take care of ourselves.
Yeah.
So thank you again, and we hope to Psyconnect with you once again in the near future. And to our listeners, thank you guys for listening to us or watching us. You can Psyconnect with us on Instagram, Twitter, Facebook, and YouTube now, or go to our website, letspsyconnect.com, or send us an email, discussion@letspsyconnect. Yes, discussion@letspsyconnect.com. I think I got that right. That'll be on our description as well. And remember, let's Psyconnect.